you recording, Joe? I'm going to record. Okay. Good evening, everybody. Thank you for being so flexible with the timing of tonight's webinar, as well as the switching of the webinar link today. We had some technical difficulties, but again, thank you for being so flexible and joining us here tonight. Tonight's webinar is brought to you by Brightbod, the fine folks at Brightbod. As a reminder, I am Kelly Parker. I am an 8-year breast cancer patient, 3-year metastatic breast cancer patient, but I'm not a doctor, so please don't construe my feedback as medical advice. For the folks that are not watching live, please feel free to go record yourself asking a question on the brightbod.com website. If you do that, then we'll actually go out there and record ourselves answering the question for you, so you can still interact with us even if you're not watching on a live basis with a live feed. Tonight's presentation will last about 20 minutes, and I'll go and mute your guys' microphone during that time. After that, we'll open it up for questions. Like I said last time, your questions are my favorite part. This is where I really get to interact with you guys, and I certainly appreciate the thoughtful questions you guys put into it. So let's go ahead and get started. All right, so tonight's presentation is what do I need to know about chemotherapy? Chemotherapy is the basic definition of the term is chemical therapy, but everybody that hears the word chemotherapy knows it to mean the type of cytotoxic or cell damaging therapy that cancer patients get to treat their cancer conditions. So we're going to focus mainly on the cytotoxic variety tonight. And go through a little bit about how they work, what they're for, how to manage side effects throughout chemotherapy treatment, and what to do after your chemotherapy treatment's over. All right, so what is chemotherapy? Like I said before, chemotherapy is a series of medicines used to treat cancer in a variety of different types. Most people associate chemotherapy with being administered via IV, and in fact, most chemotherapies are delivered via IV. Great many deal of cancer patients have a port. I'm not sure if you can see this, but I have a port under the skin, and the port is a direct line to my heart, so they're able to get the medicine to my blood system a lot faster and without damaging the veins in my arm too badly. Many cancer patients that have the veins accessed again and again have issues with phlebitis, which is a blood infection, or overall just damage to the veins because the chemotherapy is toxic to your body, and it can actually cause hardening and a lot of pain when getting chemotherapy in your peripheral veins. So most longer-term cancer patients have a port, and this port can be used for testing and blood draws and that kind of stuff too. So the port really becomes your friend over a time period, and it's a lot easier to access, a lot less painful than having your veins accessed on a regular basis. Most folks don't know that chemotherapy can actually come in a pill. There's a couple types of chemotherapy that are oral chemotherapies. They don't have quite the same side effect profile as your IV chemotherapies. Most of them don't cause hair loss, for example, but they cause a lot of fatigue. They cause a condition called hand-foot syndrome, which actually causes the skin on your fingers and toes to blister and peel as if you were having burns on a regular basis. But it's used to treat a couple of different types of cancer. Breast cancer is one of them. Colon cancer, leukemia is another type of cancer that the oral chemotherapy is utilized for. And it's relatively new. It's about 15 years old when that first hit the market. But a lot of patients get a really good benefit out of it. The third way to administer chemotherapy is what's called a push, which is if you see that very end picture over there, it's a very large IV push, basically, and it gets pushed directly into your heart through the port in most cases. This is something that they typically administer chemotherapies that are especially toxic, that are not really preferred dripping into the vein little by little. They want to control the speed at which this is being administered. The drug that you see right there is actually called adriamycin. It is fondly known as the Red Devil. It is one of the most aggressive chemotherapies, difficult to take. It causes tremendous mouth sores, a lot of nausea, a lot of fatigue. That was the first chemotherapy that I took as an early stage breast cancer patient. So not easy drugs to take, but for many people, chemotherapy can be life extending or life saving, and people liken it to basically killing yourself and bringing yourself back to life after your body begins to heal. Chemotherapy does not discriminate against cancer cells. So it's basically looking for any cell that is quickly dividing. It doesn't know the difference between a cancer cell and a mouth cell, or a cancer cell and a hair follicle cell, or a stomach cell, or a female cell. Those cells are going to be killed indiscriminately. So this is why people get sick in a lot of cases when taking chemotherapy, because their good cells are being killed right along with the bad. So the future of cancer care really looks at targeting cancer cells rather than just killing everything that's growing quickly. There's a lot of cancers out there that don't grow quickly. So, for example, estrogen-fed cancers of the breast, of ovaries, uterine, they grow very slow. So they're going to typically evade treatment, and those lead to a later term recurrence risk as well. All right, so how does chemotherapy work? There's about 13 different types of chemotherapies, but I went ahead and listed the primary types, the larger categories. People just think chemo is chemo. It's one drug, it's one, it makes your hair fall out. Chemo is a very complicated treatment that attacks cancer in a variety of different ways. So, for example, there's a type of chemotherapy that's called an alkylating agent. And alkylating agents keep the cell from reproducing by damaging the cancer cell's DNA. It's a relatively new type of cancer treatment as well. And these drugs work during all cells or all phases of the cell cycle. These drugs consist of platinum-based chemo. So if you've heard of Platinol or carboplatin, those are drugs that attack that damage the cancer cell's DNA during the phase of cell reproduction. The problem is they're also damaging the cells, the good cells, the non-cancer cells as well. So the good thing about that is that normal cells are able to reproduce, but you do have that short time period of nausea, vomiting, mouth sores, and that kind of thing to contend with as you go throughout your cancer treatment. Another major category of chemotherapy drugs consists of antimetabolites. And this is where that oral chemotherapy that I mentioned to you earlier falls into. Antimetabolites interfere with DNA and RNA growth by substituting for the normal building blocks of RNA and DNA. The reason that cancer exists is because it has gone awry. Something in the genetic code for that particular cell has gotten messed up. And it doesn't know when to die. So basically these anti-metabolite drugs address the damages to the DNA and try to help it go through the apoptosis process. And apoptosis is really just a fancy word for programmed cell death. In a normal person's body, a cell that gets damaged knows it's time to commit suicide, cellicide, I guess. But cancer cells don't know how to do that. In fact, they continue to grow at a crazy, alarming rate. Antimetabolites work against that and help the cancer cells know when it's time to die. All right. The third major category of chemotherapy types are anti-tumor antibiotics. And this is not your typical antibiotic, I can't even think of the antibiotic name, erythromycin. This is not a typical antibiotic that you take for when you have an infection. these are high-powered antibiotics that that address the cancer growth by changing the DNA inside the cancer cell and keeping it from growing multiple times. It also addresses the angiogenic process of a cancer tumor. So angiogenesis is basically the calling of blood vessel cells to the cancerous tumor because it actually needs a blood supply to grow. So cancer works in a very sneaky way by using your body's own defenses against itself and allowing angiogenic processes to begin. So if you look at a cancer tumor on a scan, for example, you'll actually see little blood vessels going into the tumor and feeding it from within. Before a cancer can grow bigger than 3 millimeters big, it actually has to have angiogenic properties occurring. Now, some people's bodies actually resist this angiogenic process, and these patients are less susceptible to developing metastasis and even primary cancer. So we're learning about these people's DNA and these anti-angiogenic factors and trying to determine how can we replicate this in a patient that has metastatic cancer or primary cancer, because if we can stop it from growing more than 3 millimeters, it's not going to be life-threatening. It's not even going to be something that's going to cause a whole lot of harm. So that's something that science is really focused on right now, trying to address that piece of it. So what are chemotherapy side effects? Everybody's heard about hair loss, and I actually didn't even put hair loss on this one. It's because a great many of chemotherapies don't actually cause hair loss. And nearly every medicine that they prescribe for breast cancer does cause hair loss. Most of the chemotherapy for lung cancer and pancreatic cancer are also going to cause hair loss, but there's a great many chemotherapy regimens for colon cancer, for prostate cancer, for example, and of course the capecitabine Xeloda, which is the oral chemotherapy, does not cause hair loss. Some of them cause hair thinning, but the typical cancer patient has no hair, right? This is something we're trying to combat and help people understand that it's not just about the hair loss, and there's a lot more going on under the surface when it comes to what chemotherapy is doing to your body. So chemotherapy in the blood, one of the most common side effects of chemotherapy in your blood is neutropenia. And neutropenia is a severe lowering of your white blood cell count. It can also affect platelets, red blood cells, can affect iron levels. This is primarily what's making people susceptible to infection. This is what's making people tired, lethargic, because basically your defenses are being stripped from you by the chemotherapy drugs. There's a treatment that most cancer patients on difficult chemotherapy receive exactly 24 hours after that treatment, and it's called Neulasta. Neulasta or Neupogen is a different version of it. But you may have seen commercials on TV talking about Neulasta Onpro, where there's like a little sticker on, and a day later it automatically deploys and shoots you with a drug that helps stimulate your white blood cell count. That would terrify me. I don't know. I don't think I could handle waiting to that shot hit me in the arm. But these drugs are phenomenal in preventing infection-related issues because of the white blood cell count. And that's the primary reason for treatment delay is, you can't continue to tear your body down again and again and again, because it literally will kill you if you don't take the time to recover. The issue with drugs like Neulasta and Neupogen is that they cause tremendous body pain. Most of your white blood cells are made in your sternum, in your breastbone, and also your long bones in your leg. So basically it causes a much greater activity in your long bones and your sternum, which can literally cause your bones to vibrate. The pain is sublime. But it reduces the risk of infection down to about 3%, which is phenomenal, and it allows the patient to receive treatment on schedule, which really is the best chance of receiving a better response to the overall treatment process. It's pretty infrequently known that chemobrain is something that is a side effect of chemotherapy. So chemotherapy causes cognitive impairment that lasts sometimes, weeks, months, sometimes it's permanent in certain patients. And it does so by causing damage to some of the cells of the brain. Most patients on chemotherapy report short-term memory issues, difficulty doing tasks that they did easily before. I remember distinctly not being able to do my job. I mean, I knew what I was doing. I just couldn't find the right process to go about doing it. So I remember just staring at my computer screen and crying because I never expected it to be that bad. So we certainly ask, as cancer patients, the world to be patient with us as we rebuild those faculties and become a little less absent-minded, because it's a real medical condition in the brain. Mouth sores, also something people don't really know much about. It's a common side effect in a lot of the push drugs, like I showed you guys earlier, and it's also going to be a big side effect from the anti-tumor antibiotics that we talked about earlier as well. And these mouth sores aren't limited to the mouth. They actually can go all the way down the throat and down deep in the esophagus. So a lot of patients report having difficulty swallowing, difficulty keeping food down because it really does hurt to eat. There's a number of different mouthwashes that patients use, and even some mouthwashes that are swallowed to help with that. And many of us will actually hold ice water in our mouths while getting the push, because you can actually feel chemotherapy coming up in your throat and causing damage to those healthy esophagus cells and mouth cells. So prevention is a really key factor in the mouth sore world. So it can't prevent everything. So we manage it with things called magic mouthwash and Biotene and stuff like that. And of course, maintaining good oral health is really important when you're working with mouth sore. Something that nobody likes to talk about are the digestive issues that are caused by chemotherapy. So everything from diarrhea to constipation, and you can experience that in a very short amount of time where it's going from one extreme to the other. Chemotherapy can be very dehydrating. So as you're going through treatment, make sure that you stay well hydrated and drinking lots of water to flush out all those toxins, to remove them from your body once they've been administered. Chemotherapy is toxic to your heart. So there's some drugs, for example, like the adriamycin, the Red Devil, that you actually have a lifetime cap where at a certain point that drug will actually make your heart stop beating. So I've reached my lifetime cap of adriamycin. I won't ever get to take it again, which I'm more than happy to oblige. There are other drugs that are more cardiotoxic than the adriamycin, but it's certainly up there. It can cause damage to the valves and cause damage to the blood vessels leading to the heart. So this is another reason we need better treatment options for cancer, because this is unacceptable to have to choose between having a heart attack and treating your cancer. Certainly not something I would ever want to have to choose again. Muscles and motor skills. In addition to chemotherapy's effect on your muscle movement, just the overall lack of activity that most people experience when they're going through cancer treatment. Typically, muscles will atrophy. You'll experience muscle breakdown. It's important to stay active during chemotherapy. I know that seems a little counterintuitive, and people are like, well, I'm exhausted, I can't stay active. I promise you, it is something very well worth the investment. If you're able to stay active, take a short walk, take a quick bike ride, it will certainly pay dividends down the road. And it'll also help with some of the chemo-related weight gain. Yes, I said gain. Most people assume that I'm on chemo, I want to lose a bunch of weight and look really, really fragile. In most cases, with all the steroids being administered to protect your body before you actually get the chemotherapy, most patients actually report weight gain, especially for cancers of the breast and the ovaries and the uterus. In many cases, it can be 20, 30, 40 pounds or even more. So another body image issue to deal with, obviously, and another factor to consider for your health. So stay active. It'll certainly help with side effects and also with some of that unintended weight gain as you go through the treatment process. Nausea and vomiting is another one of those constant Hollywood reminders of chemotherapy. They have tremendous drugs now, antiemetics, that allow you not to throw up, not even once. The nausea is there, but there's some really fantastic drugs on the market today. Aloxi, Zofran's an older drug, but Aloxi is a drug that they typically administer before you get chemotherapy. So they call it a pre-med, and it will literally prevent every bout of vomiting in most cancer patients. So they've come a long way. When I first started cancer treatment in 2009 for my early stage breast cancer, I remember I would get one of those pills, be $100 a piece, and it was just a sample that my oncologist had. So it was certainly something I was glad to have, and I was just hitting the market at the time. And then the last major side effect of chemotherapy that I have listed is loss of appetite. Many patients report taste changes, things tasting really metallic or oily, just an overall difference in what their palate is used to. We recommend, of course, not eating your favorite foods on days of treatment because it can actually cause you to dislike them a great deal, especially if you were to get sick on one of your favorite foods. So they typically recommend bland foods, bland diet. Try to stay away from anything spicy because of those mouth sores, and make sure you're getting enough nutrition. The protein intake is really important during chemotherapy because it's going to help build those muscles back up and also help your body repair a little faster as you go from treatment to treatment. All right, so we kind of already touched on this, but the question is, how should I care for my body during chemotherapy? And there's a lot that you can do to help prevent some damage to your body and help recover as you're going through the chemotherapy world. We mentioned this earlier. Really focus on drinking lots of water. You're going to want to get all those toxins out as quickly as possible, and you want to help your kidneys get rid of that. So while you're getting treatment, after treatment, make sure to keep on drinking lots of water. Stay away from alcohol. This is just going to further dehydrate you. We want to stay away from fatty or fried foods as well, any spicy or acidic foods or caffeine. These are going to make your mouth sores worse, and it could also cause nausea issues, even if you're craving something fatty, which is something that many cancer patients report as they're going through treatment. So do try to limit that. Sometimes if you're hungry for nothing else, it's all you're willing to eat, and there's nothing wrong with that. But obviously, balance is key. Many patients report having heartburn. So some of them try a calcium supplement in moderation. Basically, it's similar to what they put in Tums and stuff like that. So it helps address some of those heartburn-related issues. In some cases, they have to actually take a medicine like Zofran or something like that to keep the acid from building up in the system. Stay away from high-fat foods, again, tobacco, alcohol. It's going to really dry your mouth out and make the mouth sores worse. And if you don't have mouth sores, it can actually still cause damage to your mouth and to your teeth because of the dry mouth associated with the chemotherapy. People that had fantastic teeth before treatment report having terrible cavities and dental issues after treatment. So the chemotherapy does definitely have an impact on your teeth. So do, again, keep the oral hygiene at its highest level. Keeping the mouth sores and throat sores at bay. Of course, liquid meals are a lifesaver for some people who just can't eat solid food. It's a real challenge when you're trying to swallow something and your throat is telling you no. And it's not like a sore throat. It's something very different. It feels like like there's sandpaper being rubbed on your throat from the inside out. Many people are able to eat like an Ensure or a high protein shake or something like that just to get some nutrition. It's important that you get some calories, and in some cases more calories than before you were on treatment, because your body needs those extra calories to recover. Definitely want to incorporate some potassium-rich foods in your diet. It's going to help with diarrhea. It also can help allay constipation if you're dealing with that. And we want to try to stay away from dairy as well, because it's going to incorporate some mucus into the system that we want to try to stay away from. Mucus can be pro-cancer in some cases too. So the oncologist will definitely talk with the cancer patient as they're going through treatment. This is a general guide to how we should address nutrition. Some of them may recommend more protein than what we talked about. Some of them may recommend more fat, or creating a really high fat or high calorie shake in some cases, so people can keep the weight on for the folks that are losing weight during treatment. So it'll be a good conversation to have with the oncologist to make sure that you're getting your calorie needs met and nutritional needs met as you're going through treatment.
Kelly, may I ask a question?
Of course.
Great, thanks. You mentioned there are a number of different types of chemotherapy. How can a patient know whether or not the chemotherapy that's being selected is going to be a good fit for him or her?
That's a great question, Joe. There's a lot of really great resources online that walk through typical chemotherapy regimens that are given for a particular cancer type. And in most cases, there's not just a single agent administered. So there's ACT, for example, which is Adriamycin, Cytoxan, and Taxol. So they work better together in combining their strengths and preventing the cancer from recurring in many cases. I really recommend getting a second opinion for everybody based on what their doctors recommend. The worst that could happen is they get the same result that they already got from their first oncologist. But there's a lot of really great resources out there, and Brightblood is becoming one of them, right? So you can compare notes and find out, well, I have metastatic colon cancer or whatever. What drugs are you taking? There's a number of different standard therapies that are approved by the FDA today for what we call first, second, third, fourth line therapy. So if you're diagnosed with stage 1 breast cancer and you are HER2 negative and you have ER and PR receptors, estrogen and progesterone receptors, there's only about 2 drugs that you can take in the first line setting. So that does limit the opportunity for improper treatment. But I certainly would seek a second opinion in all cases, just for that peace of mind and make sure that you're on the right track. You're muted. Can't hear you.
Thank you. I actually have another question. You were saying that that there's a limit because of the toxicity, and that it could be too toxic for your heart. So at what point does that happen? How does the patient know when he or she has gotten to that limit?
Great question. So the doctors will actually calculate your limit based on your weight, your age, and that will be something that's known from the very beginning. So I would certainly make sure that you ask that question, okay, what is my lifetime max or my lifetime cap for this particular drug? And many of them are cytotoxic. Many of them are toxic to your kidneys, toxic to your liver, and everything's processed by the liver as well. So find out from the very beginning what your lifetime cap is going to look like. That will allow you to track as you get treatment and make sure that you're tracking along with the doctor, that you're not getting anything more than what you are supposed to have that is critical to your health. Don't assume just because they're a doctor they're going to make things perfect. I remember sitting down at the chemotherapy chair and they hooked me up to my IV and they started to administer my first drug, and I'm like, whoa. I hadn't gotten my pre-medication yet. I hadn't gotten my anti-nausea medication, my steroids, or my Benadryl, which helps prevent some allergic reaction in the taxane chemotherapy group. But it's something your doctor should be able to share with you up front, and that you will be able to actually see the prescription that's being administered. You'll know this, 235 milliliters of Cytoxan or whatever the case is, and you can track it along with the doctor. Don't ever assume that just because they're a doctor, they have everything all under control. You have to be your own advocate. There's no question about that.
And just the last question. You mentioned apoptosis, I think it's called, can you please describe that?
Absolutely. So apoptosis is the process, it's known as programmed cell death. So when a normal healthy cell gets damage to its DNA, it then knows it's time to commit suicide. It's time to kill myself because I don't need to replicate. Replications and copies of me will be bad news for the person's body. There's actually an apoptotic or tumor suppressor gene. It's called the P53 gene. And P53 gene is something that everybody has. In some cases, and actually a very common factor in cancer patients, they have a damaged P53 gene that they've inherited from one of the two parents. This can allow the overgrowth of cancer cells and can lead to the proliferation of tumors later down the road. So they're deeming it the Achilles heel of cancer, P53 gene, because if they could figure out a way to turn that off or to correct the DNA damage, researchers could actually help eliminate cancer in many people's bodies. It's a pretty cool thing to see a single factor that many cancer patients have. I personally have a damaged P53 gene. So again, apoptosis is just the process of programmed cell death, something that cancer cells do not know how to do, and yet continue to replicate many copies of themselves without inhibition because they don't know it's time to die.
Thank you.
Absolutely. All right. So many people ask, what are my treatment goals? What are you hoping to accomplish during chemotherapy? What is our goal when this is all said and done? And it really depends on the cancer stage, how advanced the cancer is, where it's gone to, what kind of cancer it is in many cases. It's a very personalized goal. A number of people believe that just because they're on chemo that the goal is to cure. And that's just simply not true. And this really was down to doctors being very candid with their patients. I can't tell you how many times I've sat down to go get my shots, which is what I get as a stage 4 breast cancer patient now. I don't get chemotherapy since the goal is not to cure me. But I meet people all the time that are sitting in the chair saying, well, I'm going to be cancer-free in a couple of weeks after I finish chemotherapy. And I've said, oh, tell me about your cancer. And they tell me they have stage 4 pancreatic cancer, which is terminal. Or they tell me they have stage 4 colon cancer, which is terminal. Metastatic cancers are terminal. It's not a pretty sight. It's not a fun thing to talk about, but it's the reality of it. But so many of those patients that are sitting in that chemo chair believe that they're there to be cured. And that's just simply not the case. In fact, there was a study that looked at some of the top cancer institutes in the country. So MD Anderson, Baylor, Dana-Farber. And they asked patients who were expected to live less than 6 months. So these are patients that are on the verge of hospice. They asked them what the treatment goal was, why they were getting chemotherapy. And 90% of them could not articulate what that meant for them. So 90% of the patients either believed to some extent that they were there to be cured or that they had longer time left than what they actually had. So there's a real epidemic of doctors not being honest with the patients and really leveling with them and saying, listen, I don't know how long you're going to live exactly, but your disease is not curable. It's not chronic. It's something that you will not die with. You will die from it. It's a great big difference. You maybe have seen recently that Olivia Newton-John was diagnosed with stage 4 breast cancer. after 20 years in remission, metastasized to her bones. And she is right now talking about taking cannabis. It's going to cure her. She has a 95% survival rate. It is completely misleading. It is a lie. She will not survive this. She may live 10 years with it. She may live 20 years with it. I don't know how long she's going to live. But stage 4 breast cancer is terminal. And people really need to understand what the treatment goals are, and what the reasonable expectations are whenever you are a stage 4 cancer patient. For most of the cancer world, so the earlier stages, 0 to 3C, the goal could be curative intent. And that's why they break out the big guns when it comes to treating patients who have a real honest to God chance of being cured. So cancer is localized. It's not spread to a distant organ or bone. There may be cancer cells at a microscopic level. So the curative intent chemotherapies are typically big gun. Typically they want to go first the slash and burn overkill treatment option, and they're going to give you as much as you can handle. Now that doesn't mean that you can't say I've got too much, or I have too many side effects, or toxicity is actually going beyond what the benefit might be of keeping that cancer from recurring down the road. For example, when I was getting treatment for early stage breast cancer, the second drug that I received was a drug called Taxol. And Taxol makes your fingernails fall off. It causes really terrible neuropathy. And neuropathy is basically damage to the nerve sheath on your fingers and toes. We actually had to stop treatment early. So, let me see. Joe, do you have something for me?
I think it's time to open it up for questions.
Okay, we can certainly do that. What questions do you guys have for me?
Hi,
Kelly.
how you doing? I'm not sure if you mentioned it earlier, but how would you recommend dealing with your mental health during this time?
That is a phenomenal question. Many people look to spirituality during this time. It is whether you're going to a church or seeking a support group, there are people there that know what you're going through, and certainly can help ease your mind a little bit. Some people look to journaling. They can actually write down their fears, their feelings, and it's a very cathartic and productive exercise for patients that are going through cancer treatment. Many patients look to yoga or physical activity to release some of that stress as well. It boils down to what you want to do to get that peace of mind and to make sure you're getting the support that you need. Social workers at the oncology clinic typically have access to a wide array of mental health options. Some patients end up on antidepressant during treatment or even well after treatment. So there's definitely access to a great many support groups and support structures to help patients that are going through chemotherapy treatments.
Thank you.
Great question.
Kelly, got a question. You mentioned you go in for shots. Is that like some kind of a preventive medication, like to prevent a reoccurrence, or what is that actually?
So that's a great question as well. I have stage 4 breast cancer. So my breast cancer has metastasized from breast to my bones, quite many of my bones. So there's no prevention for me. I'm already at the most advanced stage of breast cancer you can get to. The shots I get are called Faslodex shots, and they basically block hormones. I get them in the butt every single month, and it blocks estrogen, which is what my cancer feeds on. So it's been keeping me in remission for going on 3 years. It really has been a miracle drug for me. And I also get a shot in the stomach that's called Xgeva. And Xgeva is a drug that's called a biphosphonate, and it really just helps make my bones stronger. So if the cancer is eating away at the bones, which it hasn't done in a while, but it still pulls calcium from your blood and puts it back into your bones, where cancer will deplete that over time.
And did you say that was monthly or did I not?
Monthly. Yep.
Okay.
Every 28 days. It really is an easy treatment to take. I mean, I also take a pill every day, which is a targeted therapy, but I haven't had chemotherapy since my stage 3 recurrence in 2013. Since the goal is not to cure me, they want to keep quality of life, balanced with what the treatment goals are. So we're going to save big gun chemo for much later, hopefully, when the cancer progresses. But right now I'm stable on hormone therapy.
Thank you.
Thank you.
Kelly, can the chemo brain be reversed?
Hey, Marilyn. Can it be reversed?
Yeah, the damage.
Absolutely. So after chemotherapy causes cognitive impairment, it takes about 2 years to get it all back. Working crossword puzzles, keeping your brain active, challenging yourself on a daily basis will help that get better faster. But in some cases, there are impairments that last a lifetime. It depends on age, and in some cases, how long you've been on chemotherapy as well. When patients have a complication of, being put into medical menopause or chemical castration for males, that's also going to impact your memory too. So patients have kind of a double whammy when they have their ovaries removed or their chemical castration for a male, because those hormones play a vital role in memory and accessing information in certain parts of the brain. So it is reversible. It can get better. It's adding insult to injury right after you get done with treatment and you can't remember how to do simple tasks that you could do very easily before.
Okay, thank you.
Thanks, Marilyn.
Kelly, would you still recommend a support group for someone with stage 4 cancer or stage 4 breast cancer?
I would, and I would recommend a support group that is unique to stage 4 cancer. I have been to early stage breast cancer support groups, and their one fear is becoming me. I'm their worst nightmare. And I'm not getting much support from them because I can't talk about end of life issues or, hospice planning, fear of when I'm going to get the bad news that it's gone to my liver, lungs, or brain. It has been my lifeline, most of it actually being online through Facebook communities and stuff like that, where I've met countless young women with stage 4 breast cancer. And they have truly kept me going when I thought that I couldn't go on any longer. My best friend Lisa is here local in Arkansas where I live, and she also has stage 4 breast cancer. So that in-person support that I get by visiting her on usually a daily basis and that I get online is the best therapy that I can get. We are in the process of starting up the stage 4 support group here locally, and not just breast, but other metastatic cancer types, because we do have such a unique need set and we have such unique challenges. We're not going to be able to fit into a mixed community where early stage patients are there talking about their worst fears, which are recurrence based, and we're there living it. So it really isn't a good mix to keep those earlier stages in there together.
Okay, thank you.
Thanks, Melanie.
As part of the whole palliative care thing for this type of cancer, is it ever recommended to have like a therapist or anything like that? Someone that, you can just be totally open with about everything?
It is absolutely recommended to have a therapist. And in many cases, oncologists are ill-equipped to deal with some of the psychosomatic effects of going through terminal cancer diagnosis. My oncologist wasn't ready for that. I experienced the darkest, craziest depression I'd ever known in my entire life. I lost touch with reality. I eventually was committed to an institution for 2 weeks where I could get the care that I needed, because I just couldn't go on living knowing that I would have to live with cancer. And it's not just about throwing medication at people either. Here, take this pill, you'll feel better. There's a lot of complex emotions and fears and guilt that people have to work through when they're diagnosed with stage 4 cancer. So I thoroughly recommend getting a therapist that may be inside or outside of the oncology clinic that you see. It was the best thing I could have done for myself, and continue to see them on a regular basis. So I think everybody needs a therapist, not just cancer patients. Great question. What else you guys got for me? That's it.